Okay, we're going to go ahead and get started. But good afternoon. My name is Victoria Tyra, and I'm the Rural Education Manager with the Michigan Center for Rural Health, and we'll be helping to facilitate this program.
Yeah, I'm looking at our ad center.
Sorry about that. And I will be facilitating this program. I would like to welcome everyone to today's special topics grand rounds on working together to prevent suicide among working age men in rural communities. This is a collaborating with researchers and practitioners in Michigan. This program is jointly provided by the Michigan Human Medicine, Michigan Center for Rural Health, MSU College of Nursing, and the Michigan Social Work Collaborative. Before we begin the program, just a couple of reminders. If you're logged into the webinar portion and have computer speakers, you can listen to the audio through them. If you're listening to the program through the audio numbers, I'll be putting the handouts on our website shortly. Handouts, as I mentioned, will be located on our website. Our website is www.mcrh.msu.edu. Education link across the top, and then scroll down, find today, and then find today's date, and then there you will find the presentation. Continuing education is available for physicians, nurses, and social workers at this time. There is a new process for CE. There is no attendance form. Your registration was your attendance form, so the evaluation will be emailed directly to you following this program. If you attended in a group, please send me a list of everyone that attended at your site with a first and last name and their email so that everyone gets the evaluation. The evaluation must be completed online or within 2 weeks or by January 28th. If you would like to ask a question during the program, please type it into the chat box so you don't forget it and our presenters can address it during the Q&A. Our speakers today indicate no conflict of interest, and our planning committee did not have any conflicts. There is no commercial support with this program. And with that, I'm pleased to introduce our speakers, Dr. Jody Frey, who is a professor at the University of Maryland School of Social Work, and the network director, Kay Balser, who works at the Thumb Community. The Thumb Community Health Partnership, right? And then the program director, who is Carrie White, and she works with Kay. With that, I'll turn it over to Dr. Frey.
Thank you, Victoria. I'll go ahead and share my screen for folks. It's great to see everyone today. Let me just, you probably don't want to see yourselves, you want to see the slides. Can everyone see the slides okay? Great. Well, thank you for the introduction. I'm Jody Frey from the University of Maryland School of Social Work, and I am a researcher that is working closely with folks from the Thumb Community Health Partnership, as well as many of you on the call today. It's great to see some familiar names, and we're excited to talk to you about an initiative that's addressing suicide prevention with working aged men. So I'm gonna go over our objectives really quickly. Number one, to introduce you to Man Therapy, which is an online intervention to reduce suicide risk among working aged men. We want to be able to describe public health messaging and how we're doing that to outreach and engage working aged men, particularly those in rural areas. And then we want to work with all of you to formulate a plan so you can take some of these high tech or high touch interventions and have a way to bring that back home to your own professional organizations, community groups, and workplaces. So just to kind of set the stage in terms of our suicide death rates, probably many of you on the call are familiar with the data from the CDC that tells us about suicide death rates for both men and women increasing over time throughout the US. And particularly, we see this among men in their working age years. When we actually break down the data, we can see that men and women between the ages of 45 and 64 have actually surpassed older adults during the time frame of 2009 to 2018. Unfortunately, Michigan is not different in terms of the perspectives of what we see nationally. This is the data from 2020, the most recent information that we have. And it tells us in particular, if you look on the right side of the screen, that suicide is the 10th leading cause of death in Michigan. And one of the areas that we're very concerned about in this particular project we'll discuss today is that it's the 4th leading cause of death for individuals, adults ages 35 to 64. So Michigan is higher than the national average. But Michigan is also, I would say, and maybe I'm a little biased, even though I'm a Marylander and not a Michigander, I think Michigan's also taking a real leadership role in the country in terms of using innovation and different methods to address suicide prevention, as well as you can see here in the second statistic, the access to care, which is really something that's going to come up in the second half of our presentation when we talk about reaching out and connecting with rural adults and families. So this is just a sneak peek of what's to come from my partners in the Thumb Partnership Group. But in 2014 to 2018, our Michigan mortality data actually showed that the 5 counties with the highest adult male suicide death rates were all in rural counties. And this has some of the data with some of the counties that are known to many of you as the Thumb. So what's going on when we think about men and suicide risk? There are a number of factors that are social, cultural, as well as education and access that prevent common barriers for men in help seeking. So if you think about masculinity, gender, socialization, and some of the stereotypes, a lot of men and a lot of women, a lot of people in general feel like if men show their emotions, their feelings, that it's a sign of weakness. And that really increases the stigma and the barriers about seeking help. A lot of men tell us that they fear being labeled if they were to seek services. And they often will look for other means to self-soothe. And that may include substance use and misuse, which is very comorbid with suicide, as well as thinking about, I need to be able to fix this myself. That's a theme that we hear a lot from our men, but they don't always have the knowledge and the information and the resources that they need. So as a clinical social worker, I've always worked in male-dominated spaces and workplaces. It just happened to be a niche in my private practice. And a lot of the language that I was used and trained to use as a behavioral health professional just didn't resonate or communicate with the men that we were trying to support. So I'm going to introduce Man Therapy Michigan, which for those of you that have worked with me in the past, you're familiar with Healthy Men Michigan, and I'll provide some background about that and how we got here. But one of my favorite taglines from the Man Therapy group is, "You can't fix your mental health with duct tape." And in fact, some of you in the Thumb County and Lapeer County actually had this as a billboard during our first campaign. So what is Man Therapy? Man Therapy is reshaping the conversation about men's mental health, including suicide. And it's doing that in an innovative way that takes hope, resilience, recovery, and actually mixes it with humor. I did not create Man Therapy. So as an objective researcher, I'm very impressed with Man Therapy and what we've been studying. But to be honest, as a clinical social worker, I know about public health messaging and suicide prevention, but I'm not really that funny. And men told the Man Therapy folks that they wanted it to be engaging. They wanted to take those stereotypes and just kind of face them head on and use them in a way that's going to make them think about how they're thinking, how they're feeling, how they're behaving, and challenge a little bit. But they also wanted to have resources anytime, anywhere that they were ready to talk about this. And they wanted to hear from other men about hope and resilience. They didn't want to talk all about depression, substance use, and all the negatives. They needed it mixed with the hope. So Man Therapy in Michigan's been around. We are launching some new campaigns, but you can see that men are already using it throughout the state, including some of our rural areas. And as I mentioned, Man Therapy came out of research, focus groups, interviews, surveys with men starting in Colorado, but has expanded to many states. And there's a white paper that you can read about the history of Man Therapy, how it was developed. There's a PDF link here on the slides that you'll get from Victoria, and also any of the presenters today are happy to provide more information. So This is actually not my office that I'm sitting in right now. I'm sitting in Dr. Rich Mahogany's office, and he is the fictitious therapist of mantherapy.org. This is a picture of him. So when you go to mantherapy.org, you'll be greeted by Dr. Mahogany. And you know, he's a character. He embodies the stereotypical masculine male, you know, uses male-centered language and humor to talk about mental health and to talk about help seeking. There's a lot of testimonials on the website. It's free, it's available anytime, and a lot of links to both national and local resources. There's a 21-point head inspection, which is the assessment tool Man Therapy uses to give some immediate feedback about where are your strengths and where are some places that maybe you need to work on to improve your mental health and well-being. And it takes it all with a humorous perspective. So if you haven't had time to look at mantherapy.org, I strongly encourage you to spend some time peeking at that because it's been really popular with men, particularly in working aged years. But let's take a step back for a minute because I'm here as the researcher. So I want to fill you in on some of the work we've been doing in Michigan, and then we'll jump forward to where we are today. So this was actually a CDC funded study, Healthy Men Michigan, that was created to test the effectiveness of man therapy to reduce suicide risk and also depression and increase help seeking. So this website is no longer there, by the way. If you go to Healthy Men Michigan, you'll be redirected to a site on my university page. But we were engaging men aged 25 to 64 to come and do a free online anonymous screening. And if they screened at a certain level of risk for depression and suicide, they were invited to be in a randomized controlled trial. And so half of our men were exposed to a basic depression screening tool online that gave immediate feedback and referrals. And the other half of our men received that, plus they were invited to explore the Man Therapy website. And this is just our team and our funding statement. And we thank everybody, especially those of you online today that helped to promote Man Therapy. So we used a public health approach that was really a combination of high touch and high tech. We had over 230 partners that were our boots on the ground throughout the Healthy Men Michigan campaign. And they represented kind of traditional partners in primary care, hospital systems, mental and behavioral health, but also went into business partners, barbershops, casinos, the Chamber of Commerce, car dealerships, construction companies, as well as organizations in the community, like faith-based organizations or fishing, boating, and hunting associations, recreation clubs. Our point was we wanted to reach men anywhere, anytime where they might be in the community. And we were very successful in screening thousands of men through Healthy Men Michigan so they could get immediate feedback about their risk and resources. We actually worked with a number of partners you might recognize here, Jeff Elhart from Elhart Automotive, and the Detroit Lions former quarterback Eric Hipple, who's been, both have been extremely strong advocates about sharing their personal and family journey with suicide and stories of hope and recovery. Eric and I were just in an article the other day in Business Insider about some of the rebranding of Man Therapy Michigan. Amanda Mosby, my program manager, I think is on here, and she'll put the link on there to talk about the importance of screening for anger with men when we're looking at depression and suicide. We did a lot of online promotion of Healthy Men Michigan, some webinars, presenting it and partnering with Kevin Song amongst some other groups. And then we also had a lot of high touch. So we can't rely on one or the other. It's really a mixture is what we learned in any successful public health campaign, is that we needed to have our boots on the ground, that we're in the community at all different settings. And these are some of the popular creatives that we worked on with Grit Digital Health, which is the company that created and licensed Man Therapy. They really are the experts at thinking about how to communicate messages to men. You know, at first we were talking about mental illness and depression and nobody was responding. And then when we changed it up and stepped it up, you know, to talk about mental fitness and comparing, you know, mental health to physical health and using some humor intertwined, we found that men were really interested to come to the website and to check out, give your mental engine a tune-up, where we talk about get a checkup from the head up is another one that Man Therapy likes to use. So we're in the process of publishing some results from the randomized control trial, and they look very promising for both online interventions and man therapy in general. So I'm going to present a couple key takeaways from what we're working to get out there in a peer-reviewed sense. So I would ask not to share these in writing publicly without permission from myself as the principal investigator, but definitely want to give you a sneak peek. So first of all, we screened over 4,000 men in Michigan, ages 25 to 64. And what we found, it was actually a great representation based on the US Census in terms of age, race, and geographical location to match Michigan's demographics. Of those men, 3,200 were eligible for the study. That means that they either screened at moderate or high risk for depression, any risk for suicide on the Columbia Suicide Severity Rating Scale, which is really the first time I think anyone's used it in an anonymous public health screener process like we did in Michigan, or we added the item from the DSM-5 indicator for anger, because we really feel that's an important aspect of depression that men report or experience. So we had a fairly high risk study, and 554 men enrolled in the study and stayed with us over the course of the 3 surveys so we could really see what was happening. So one of the first takeaways is over time, men in our traditional Healthy Men Michigan, that depression screening group, as well as our man therapy group, improved statistically on suicide risk and depression. So this is very important for public health folks out there, that online screening really makes a difference, and being able to provide real-time results and referrals can help over time to reduce risk. We also saw that both groups improved in reducing stigma and an added benefit in terms of reducing report of their illicit drug use. In terms of men in the man therapy group, we actually found some improvements in social support, decreasing structural barriers, and psychological aggression. So thinking about some of the factors that relate to depression and suicide risk, and also our barriers to help seeking, we see man therapy as an important public health approach. We're doing some pretty complicated modeling that we're publishing right now. And we're actually seeing that for men who are depressed, their rate of improving over 3 months is significantly greater than those in the Healthy Men Michigan or that control group. So we're excited about these results that'll be out soon for you. We also found some unexpected results. A lot of times people ask, how does man therapy hold up with men of color and men who identify as gay? And so we actually found that for men in these groups, man therapy helped more on our primary outcomes of suicide risk and for depression. We tried to get another grant to explore in a qualitative way why that was happening and what was going on in Michigan. Unfortunately, it wasn't funded. But we have some theories in thinking about just how some of the men in these groups are maybe not being reached by other mechanisms and public health approaches. So perhaps man therapy isn't necessarily the end-all answer for all men, but maybe it's a good place to start. We also looked at help seeking with man therapy. And what we found here is that men not only looked at a number of the resources, but they also reported that by looking at the man therapy site, it motivated them to seek help. And some of our help seeking data that's under review right now is finding that almost 25% of the men actually by follow-up did something for formal or informal help seeking and took action. I think that's a really powerful message in looking at help seeking for a short time online intervention in public health, is to think about moving someone through the stages of change and kind of moving that needle a little bit to reduce barriers and to encourage men that may not be connected to any health or behavioral health systems to seek help and talk with someone. So lucky for us, we were able to have a mixed methods approach, which is always how I like to do research, because I like to do the interviews or the focus groups and get that deeper information of why and what's really happening. So we were able to interview men in both the Healthy Men Michigan, which is the depression screening group, and also the man therapy group. And we found a couple themes, and I'm just going to share a couple quotes with you that stood out to me in terms of the importance of man therapy. This quote is actually from a white male aged 45 to 54. He said, "It's just really nice to know there's a place for us to go, a safe environment with other men that we know about." This second quote is from a man ages 23 to 34, identified as Hispanic. And he talked about that man therapy, explains the stigma that all the years have built up and explains to you how to basically take the bricks away. The third quote I wanted to share is from a white male who is between the ages of 55 and 64. And he said, "It helped me open up my eyes to realize, yes, I have these feelings and it doesn't make me a bad person." And I think this is my last quote, is a man aged 25 to 34, was talking about kind of the do-it-yourself approach of man therapy. And he says, "Man therapy opened up a whole new world I have never even thought of as far as self-help and working through stuff at home rather than the constant, like I said, shuffle to the counselor's office every week." So what we found were that men were using man therapy not just once, but actually sometimes in between sessions. I was really focused as a researcher on thinking about how to bridge that gap to access care for men that aren't connected. And so I was really intrigued to find out that men that were in care actually used man therapy in between sessions. And I thought about my clinical days. I used to do suicide safety planning. I would write on the back of my business card what the safety plan was, and they could always flip it over to call me as one of the steps on the safety plan. But I thought, wouldn't it be great if when I was practicing, I could add man therapy as part of that suicide safety plan? Because our men told us it was just enough to reduce that suicide intensity until they were able to get help more formally or even informally through pastoral counseling or talking to a family or a trusted friend. So implications, what we found is that it takes a village. We needed to really work with our partners on the ground throughout Michigan. And we're so appreciative that, people in settings where suicide prevention wasn't even something they naturally talked about, they got on board with the mission and they understood that as a public health concern, we all have a role in reducing suicide prevention, that it's everybody's business. So Michigan, I feel like, is a true leader in thinking about ways to get the messages out to the community. And what we found is that we were able to reach this very difficult population. Number one, they're very hard to engage in online screening. Our stats, from the depression screening site that we used before doing Healthy Men Michigan told us that 70% of the people that used National Depression Screening Day identified as female. So how are we going to flip those numbers and get the majority of men coming to our site, to do the similar online screening? And we found that it truly is about the messaging. And so as a clinician, I really had to let go some of my thoughts and biases about how we should talk about suicide, because to me, initially man therapy, I didn't find it all that funny and engaging. I have to be honest with you, but that's my clinical brain. But when I showed it to some of the men in my life, they thought it was hysterical. And some of them started sharing it with their friends that they were concerned about their mental health. And so I really had to kind of push myself to think differently while still making sure that the safety messaging is in there. And I should say, one of the aspects on man therapy that really impresses me is the crisis line. So on every page, you can see this it's backwards. You can see this red phone behind me. So anywhere you're going on man therapy, there's always this opportunity to call for crisis help through the National Lifeline and Veterans Lifeline. And I think that's really important. And in fact, Dr. Mahogany sometimes takes a step back and says, if me, a fictitious doctor, is concerned about you, maybe you better take a look. And so, again, positive outcomes for both of our screening interventions. Man therapy seems to have some additional benefits for men ages 25 to 64. I think personally, tools like man therapy need to be part of a multi-comprehensive disciplinary approach to community-based suicide prevention, similar to what CDC recommends in their technical proposal. And that is actually what Michigan is doing now. So it's a wonderful new project to let you know about. The PRISM project, Preventing Suicide in Michigan Men, is a 5-year grant that was funded throughout the state to continue and expand the work that's already being done in training, in telehealth, in prevention and outreach, including man therapy. So we are getting ready to launch the rebrand of Healthy Men Michigan as Man Therapy Michigan throughout the state. We're hoping that'll be live next week, so stay tuned. But there's lots of ways that you can get involved with us throughout the state to connect, both through the Department of Health and Human Services, through their Injury and Violence Prevention Division, and also connecting locally, as we're going to hear, through the Thumb Community Health Partnership. So here are some different ways to get involved with Man Therapy Michigan. We are online. We do a lot of promotion on Facebook and Twitter. There are different ways to work with us through a Google Drive where we can provide different creative aspects. If you want to send an e-card to all of your employees, or you have an opportunity to be at a community event and you want to print some flyers, or you'd like to get some wallet cards to hand out in your office, or to have them available in your barber shop or in your coffee shop, all of these different ideas, we can work with you and think of ways to get involved. So in conclusion, I just want to say thank you to everybody in Michigan for all the work that you're doing, the passion and commitment you bring to this. Remember, men can have feelings too, no, not just the hippies. So that's a quote from Dr. Rich. And stay tuned to learn more from Man Therapy Michigan. So thank you. I will stop my screen share and turn it over to my partners, Kay and Kari at the Thumb Community Health for the second part of our presentation that's about bringing this home in rural communities.
Thank you, Dr. Fry. I'm Kay Balser, and Carrie is queuing up the slides here, so I'll just introduce myself a little bit. I live in the Thumb area and grew up in the Thumb area, and of course, as most people, have a lot of men in my life, some of who have struggled a little bit with mental health. So this project is very important, not only for our community, but also I think many of us, have a personal reason why we're attracted to this work. But I am the network director, and I have with me today Carrie White, who's our program coordinator for the Thumb Community Health Partnership. And first, I'm going to tell you just a little bit about our partnership, and then Carrie is going to really get into the nuts and bolts of what we're doing with Man Therapy. The partnership was established in 2019. We received a planning grant from the Federal Office of Rural Health Policy. Through that planning grant, in our 4-county region of Huron, Lapeer, San Luis, and Tuscola counties, we organized 17 cross-sector organizations, which includes 8 local hospitals, 4 health departments, 4 community mental health agencies, and a community action agency. And so all of these organizations have been working for about 2 years now. We started out with needs assessments and looking at, obviously, many of our organizations, actually, I think all of them, doing needs assessment of sorts. Each one is a little different based on their sector. Hospitals, of course, have a 3-year cycle for a community health needs assessment. Health departments are in the community health assessment and improvement field. And then our mental health agency is assessed annually. And our community action agency really focuses their needs assessments on social determinants of health. So we looked at all those needs assessments that had already been done and really tried to, as an organization, prioritize where we wanted to work the most. We do work in other areas and projects, but primarily we have 2 focus areas. One is behavioral health and one is obesity-related chronic disease. And we have been diving a little more deeply into these areas to gain an understanding of the bigger picture as well as the details. To help us in the behavioral health side of things, we conducted a survey assessment process this spring in March. We actually had 3 different target groups. We surveyed medical providers. We also surveyed mental health providers, and then we had a community at large survey. And we were really excited about the results and the response rates. We had 68 medical providers, 94 mental health providers, and 780 community members that responded to our survey. The survey really looked at in a short format, because we all know too long of a survey hurts the response rate. So is in a succinct format, we looked at things like stress from COVID. We looked at substance use disorders in our region. We have an opioid consortium as well. So we wanted to gather some data on their behalf as well related to substance use disorders. We looked at some issues related to social determinants of health, which obviously are very linked to being able to access services. We asked people about what's available in their communities and then asked them what prevents them from accessing services. And we're still in our analysis of our survey, but some things that seem to be rising to the top are stigma, transportation issues, and time. Those are all things that we're hearing from our participants are challenges related to addressing behavioral health needs. Our data from quantitatively, as Dr. Fry had shared earlier, is showing that in the thumb, this is definitely an issue. Suicide is for men. And this is the percent of all suicides that were men during the time frame from 2004 to 2018. And so all but one county, which was about the same as the state average, Lapeer was 78% and Michigan was 79%. But all of our other counties, the percents were in the 80s, and Tuscola had the highest, which was 90%. So without targeting men specifically, making a difference in that suicide death rate was going to be definitely difficult. And so that led us to our project. And all of our work thus far has been funded through grants from the Federal Office of Rural Health Policy, specifically for man therapy. We are funding this work under the Rural Healthcare Network Development Program. And of course, as always, when you have a funder, you like to recognize them, but also present any disclaimers. And so our standard statement here from the federal office is that we have received $900,000 over a 3-year time period for our project, which includes man therapy, but also many other things. If you're wondering about how much, in case you would like to repeat some of the things we're doing, our budget for man therapy a year is about $30,000 to $50,000, depending on our first year was a little less, but we're increasing that now. So the 900,000 is going towards a lot of other things. And so that's our project, how it's funded. And I'm going to let Carrie now talk about the nuts and bolts of man therapy and what we've been doing to reach men of working age in the thumb.
Awesome. Thank you, Kay. As Kay had mentioned, I'm Carrie White, and I'm the program coordinator for the Thumb Community Health Partnership. And I am just excited to be here today to share with all of you how we, I myself and TCHP have really led and promoted and marketed man therapy across the 4-county region. So we launched man therapy in February of this year. So we're roughly about 6 months into our campaign and kind of promoting it here locally. As Dr. Fry had mentioned, man therapy is an online resource. It is targeted towards working age men and uses humor to cut through stigma surrounding mental health. And man therapy has resources for if you have a man in your life that you're worried about. It does have a worried about you section as well. And there are just lots of great tools and resources that are available on the site. One of them being the 20-point head inspection that I know Dr. Fry mentioned. Here's an example of one of the questions that we that are on the 20-point head inspection. So they're not just yes or no questions. They are questions that really connect the physical symptoms with the emotional issues that men are facing. There are 20 questions, and then at the end, Dr. Rich Mahogany uses his calculator to kind of evaluate the responses that the men or the loved one, when they're completing the assessment, answered, and it kind of rates them A-okay, so-so, or not so good. And then it provides them with some do-it-yourself techniques similar to this one, the one on nun therapy. So walking, men need more exercise than walking to the fridge to make a roast beef sandwich. So using that humor to really target men, to connect with men and their loved ones, and making them feel comfortable talking about the issues that they may be facing. Also, at the end of the head inspection, there are testimonials. So there's lots of videos, really allowing men to realize that they're not alone and they're not the only ones that are going through something similar, and that other people go through some of the things that they may be experiencing. So with that, I do want to share some information about our local efforts, linking our community members to local resources and really highlighting the services that we have available here in our 4-county region, as well as the outreach activities that we have been doing, some local videos that we produced with some local men, and then also just sharing some progress and some real growth that we've had over the last 6 months. And so with that, so some of the local resources that we have listed really get at some of our subpopulations within our communities. So we are a rural community, so highlighting some farm resources, resources for farmers. So we have one of them being the Farm Bureau Mental Health Resource, and then also the Michigan State Extension has a farm stress program. So both of those resources are available with a website link that men can access. We have the Community Mental Health Agency listed, their website, their suicide hotline numbers, and then their direct phone numbers. So again, all of these resources are listed right here, all from the convenience and comfort of their own home. They can access those. We have resources for veterans, first responders, and then also people that may be going through substance misuse and use recovery. And really, like I said, just highlighting some of those subpopulations. And unfortunately, as the 20-point head inspection, once you complete that, there isn't like a geolocation that allows these local resources to pop up, but there is a search option. So you can select resources near me, and then you can select the Thumb of Michigan, and then the 14 resource cards that we have listed all pop up and are readily available 24/7, 7 days a week.
And just a couple other notes on the cards. We have 14 cards in total. We tried really hard to consolidate for the 4-county region. But one of the things that is just started being able to do is to track how many times those cards are clicked on and looked at. So that is going to give us some really valuable data for our local partners to know whether or not the site is actually linking people to the local resources. So we're really excited about that new piece of data that we're going to be able to pull.
Yeah. And so kind of moving into some of the outreach activities that we have been doing. This was actually one of the billboards that we previously ran. You can't fix your mental health with duct tape. Again, I know Dr. Fry said that this is one of her favorites. This is also one of mine. Being a red-green fan, duct tape is really resonates, I feel like, with a lot of men that maybe are familiar with that show and that think that duct tape maybe solves all of their problems. So also, we've been running radio advertisements, attending local events such as golf outings and other information or other events that our partners are hosting. We have had some local TV interviews with NBC 25 and ABC 12. We have done some live radio interviews as well as done some paid social media advertising. We've started doing some outreach to community organizations. So again, hitting those subpopulations and bringing this resource to where men are. So those hunting and fishing clubs, all men groups, just really bringing this and bringing awareness to this resource. And then also, we have had the ability to create some videos highlighting some local leaders across our region. We had a chance to interview kind of 6 men that really just talked about what man therapy is and brought awareness. And it really has helped our marketing here in our 4-county region, connecting kind of the local aspect of it with this program and kind of emphasizing that, local people are using this resource. And so here is the first video that we created, again, highlighting the 6 men that are kind of from this area. And I'll go ahead and share that. And please let me know if you can't hear the sound, but I did share my sound, so.
It's no secret that suicide rates are rising across the country. But did you know that here in the Thumb of Michigan, men account for 80% of all suicides? This is a crisis, and we need to do something about it.
The most common risk factors for men are recently ended relationships, personal health crisis, or financial or employment difficulties.
But the bigger issue is the stigma surrounding mental health. We've been taught that men need to be tough, and asking for help is a sign of weakness.
But it isn't. Having the courage to seek help shows real strength.
That's why the Thumb Community Health Partnership is partnering with the other local organizations to launch a campaign to destigmatize mental health issues and let men know it's okay to seek help.
Over the next several months, you may see a campaign titled Man Therapy in the community.
The campaign includes running radio and newspaper ads, billboards, social media posts, and if you are a guy, you might see the ads in public restrooms.
The Thumb Community Health Partnership is sponsoring the campaign and will also be speaking to community organizations and spreading the word wherever they can.
The campaign will let men know about mantherapy.org, a website with local resources and tips for dealing with depression and other mental health issues.
Man Therapy offers simple self-help strategies that allow men to take action in smaller, concrete steps, such as sleeping and eating well.
The campaign and the website use humor, guy humor, to get the message across.
It's time to turn the tide on suicide.
If there's a man in your life who is suffering or at risk, let them know about mantherapy.org.
Help them to get the help they need and let them know that suicide is not an option.
On January 28, 2010, my best friend and brother killed himself. It was something that I wasn't prepared for, nobody was prepared for, and it put me in a place where mental health became at the forefront for me. I pushed away a lot of friends, I pushed away family, I severed a lot of relationships because I didn't want to go through the pain of losing anybody else. And I didn't know or how to deal with what I was feeling. And this organization here, it allows men to know that it is okay to talk about your mental health and deal with the things. So suicide of a close friend, of a brother, is a horrible thing to go through, and this organization can certainly help you go through it. So don't be like me and go alone through it. Seek out help, and it will definitely help you in the long run.
The campaign is funded by a network development grant from the Federal Office of Rural Health Policy. For more information, visit www.thumbhealth.org. Members of the Thumb Community Health Partnership include local hospitals, health departments, community mental health agencies, and the Human Development Commission.
It's okay to not be okay.
So that was a short little clip that we have really used as one of the biggest marketing tools. As I've mentioned, really connecting those local faces with Man Therapy. And then this is another short little video that we also produced. So I attended a golf outing at one of our partner organizations, and I had a chance to kind of explain what Man Therapy was and hand out some flyers and t-shirts and such. And as kind of an activity for the men that were at the golf outing, I asked if anybody would be willing to share what they do to help their mental health. And they agreed that I would be able to record, and we were able to put these little snippets together, explaining what men in our local communities do to help their mental health. And so I'll go ahead and share that with you guys now as well.
My name is Scott Campbell, and I prefer to do exercise or physical activity and also get outdoors to help with my mental health.
I'm Tom Oski, and I read the Bible and pray.
I'm Bryant Wilkie. I love to take long walks, 2 to 4 miles. And I also watch good things on the internet, like happy stories.
And I'm Jeff, and I love to worship God, and I spend time with my family.
So great feedback that we received from those men that participated in that. I think over the course of the day, I had 13 men participate and share what they do to help their mental health. So those 2 videos, and I've also produced a few other additional videos from that golf outing, but those videos have been so impactful and so influential in our efforts here locally. And like I said before, the local faces, connecting them with Man Therapy has just been huge for our marketing efforts. And so with that, I did want to share some key indicators that really show our progress since January. One of them being the total site sessions. So we are always looking at breaking down by county to identify, where we could maybe do some more marketing or do some additional outreach. And so the total site sessions consist of a series of page views that a single user makes with a period of activity. So this is really important for us to continue to track so that we understand that people are coming to the site. Since January, we've had just over 650 total site sessions. And so we hope to continue that trend upward. As I know, prior to January, there was very minimum from our region. So And then also another key indicator are the completed head inspections. So identifying that 203 men or their loved ones complete or started the head inspection, and then 114 completed. And so this is a really great indicator for the fact that this is a self-assessment. This is an opportunity for men to reflect on their own mental health and really understand, connecting those physical symptoms with the emotional issues that they may be facing. And so again, most of our paid social advertising is taking them right to the head inspection so they can jump right in and start identifying, where they are with their mental health. And then the third and the last key indicator is the unique users. So this is really showing that over the course of the last 6 months, the new users, so these are people that have never been to the site, has continuously increased over the course of the last 6 months. I know in May, when we launched that first initial video, we have seen a huge increase. We've only had 4 days, I think, where there were no users from our area. And those days were either a Saturday or a Sunday. So during the course of the week, there are people always going to the site. And so I think that's awesome for us here locally to be able to share that with everyone. And then also I would just like to thank everyone for tuning in and kind of listening to what we're doing here locally in the Thumb.
And I was just going to add to some additional data analysis we did for our grant, was to look at how, it's hard to gauge, like, is this good? Is this a lot? What does this look like? And so we just looked at our population. So our population for the Thumb is about 2% of the Michigan population. And when we looked at the unique users during the same time period for Michigan, the Thumb represents 28% of the unique users. So that's telling us that our marketing is really making a difference in the Thumb, that it is getting people to the site, getting them to take the head inspection. And so that was really exciting for us. Of course, as the state project launches and gains speed, we expect that gap to close. We will probably not be quite as much high percent anymore, but we're going to continue to monitor that to see if our local efforts are continuing to make a difference. And so if you would like to do anything like what we described, please feel free to reach out to us. I did want to mention a couple of things on what Carrie talked about with Man Therapy specifically. We really have learned the value of a marketing expert. Grit Digital has been a great partner. It's not just about buying a license from them. They are there every step of the way to really help refine and hone your outreach efforts. We're doing Facebook boosts, which based on their techniques, using advertisements are a lot better for reaching your target population. And so, so we learned some things from them. And so I would always encourage you to think about that if you're doing any social media. And then the other thing, we certainly value having a nice polished product. So our first video that Carrie showed, we actually used a local videographer who, that's his business. He does a very good job. He did all the filming and the interviews and all of that. But also, if you don't have a budget for something like that, I guess I want to encourage you to, go out on a limb. Carrie used her iPhone to take the golf videos and used an iPhone movie maker, I think she called it, app, and put those together herself. So don't be afraid to either partner with someone who has those abilities or to do it yourself, because we are very pleased with how those turned out as well. And so that's a very nice small budget thing you could do in your own community. And so I think we're at the point where really, if anyone has any questions for either Dr. Fry or Carrie or myself, we'd like to entertain those either in the chat box or you, I believe, Victoria, do they have the ability to unmute themselves if they would like to?
Yep. We'll now open the time for a question and answer. So if you can feel free to type it into the chat box, or you can unmute yourself and you can ask your question verbally. I thought the program was excellent. I've been talking to John about it, our John Barnes at the center, and he loved it. I shared your guys' video with him and he absolutely loves it. So we've been sharing your guys' resources internally and with other partners of ours. So kudos to you guys.
Thank you. I see
A question, yeah.
here
It says,
from,
for those of us not in the thumb, does mantherapy.org have any resources for other areas in Michigan?
Definitely. It's a great question, Catherine. Thank you for asking. So mantherapy.org will be, is available now, as you saw. And the state has a grant to promote this throughout all the regions. We're actually putting resources online to represent the different regions of Michigan, and there are resources available. We have a Google Drive that Amanda Mosby, the program manager for the state program, just listed, where you can access information. We also can consult with you and connect if there are some different regional opportunities that you're interested in exploring. So the Thumb Group is a great example of really localizing efforts. They've been able to have additional resources through their grant to really hone in on some of the unique needs in their counties. But when we did Healthy Men Michigan, we were able to really reach men throughout the entire state. And Kay, I do think your numbers will continue to look outstanding because you have that really strong presence. But working with promotional partners, we can definitely equip you with tools that you need in your community so that you can, begin to use them as it makes sense and to customize them a little bit as you're able to. So please reach out to us through this project, and we will connect with you as a partner and provide you with resources that you can share throughout your network as they make sense.
And I'm sure that if somebody wanted to maybe even replicate what Kay and Carrie are doing from In the Thumb to other regions, they possibly could even be reached out and you guys could share your resources on how you guys even got started doing the man therapy in your guys' region.
Absolutely. And we were, I didn't mention, we found out about Man Therapy from the Rural Health Information Hub. Some of you might be familiar with that resource because we knew about our suicide rates. We were looking for, in general, behavioral health programs, but this one jumped out at us. And the Rural Health Information Hub had Dr. Fry's study on there, just a highlight of the Healthy Men Michigan and what it was, not any of the results. And so that brought us down this road that we're very happy we're on. And so we were ahead of the PRISM grant. And so we actually had already purchased a license, which allows us to, freely use all the materials that we've been given, but also put those resource cards on the site. And I don't know with the state project, what kind of things or how you're managing that. But we certainly have a lot of things that are local, but then some of the programs like the Farm Stress program that MSU Extension does, or the Farm Bureau program, those are available statewide. So there are some things that we have as local resource cards that also would apply in other areas of the state.
Right.
And just to build off of that, Kay, so the state site has a license for the whole state. And so we will have resources in the different regions. They will not be as detailed and as many as the local area for the Thumb is able to put up. We do have some limitations in the license, but all regions will be represented. We've been working through the state and our statewide coordinators for the suicide prevention training and postvention work to identify those resources.
Great. Exciting project.
And I just want to echo, we're doing a related project in Washington County, Rhode Island, which has a number of towns kind of encompassing a different type of rural environment, but some similarities with the Thumb. And we've been able to be really creative there as well. It's really the champions in the community that think about who are the local faces and people that should be spreading this information. We actually made some media talk sheets for like chiefs of police and had, medical directors, and then they can make it their own. We give them the Zoom background like what I have, and they can make their own video that can be edited, really easily and promoted on social media and emailed out, similar to how Kari made some videos. I think that's a great way to get the voice of the community out there, because men tell us over and over again that they trust their peers and they want to hear from other men. So they're not going to necessarily listen to me talking about man therapy as a clinical social worker, but they're going to listen to, their union, worker, co-worker, or they're going to listen to, their barber. So getting different voices to speak about this is really important.
And Carrie has done a super job in our area with making those direct contacts. And I tell her every time she knocks on a door, 3 open. And so I don't know, Carrie, we have a few more minutes. Do you want to share just some of the interesting, connections you've made? I know you mentioned the police. I think our higher numbers in Tuscola County are partially because the sheriff there has really signed on and has reshared the video, and they have a very large following on their Facebook. So that has helped in that county, but we found a lot of support from a lot of different places, and maybe places some of you wouldn't think to go to address this issue. So Carrie, I'll let you just share a few examples.
Yeah, so one of them that comes to mind is yesterday we actually had an opportunity to meet with a rooster ranch. So they do like pheasant hunting, and they do some duck and pigeon hunting. They have events and such, and they are on board. They have a huge following on social media, so that'll be huge when we are sending them information and giving them access to that Google Drive so that they can share information, especially during those events during their season. I've had some local connections with a taxidermist. So again, a lot of times, I know it's kind of not a deer season, but when it comes to the fall time, being able to provide him with some posters and flyers and things during his buck pull will be very influential when that time comes. And so some of those connections, even the cooperative elevator, so that's a grain kind of station, and there's multiple in each of the counties. So connecting with them is going to be a huge connection. We have just kind of gotten them on board, and hopefully to continue that relationship and be able to share information about man therapy with the men that are using their service.
And I think lastly, I know we only have a minute here, so just to sum up, it's been a great experience, but I don't want to give anyone who embarks on this path the idea that it's been flawless. We had bumped into some challenges because some of the humor some people don't appreciate, and it's not for them, and so it is something that we of course let people know. We're trying to reach a hard to reach population, and that doesn't typically respond well or respond as much to traditional messaging. So we're trying a new way of outreach, and that seems to resonate with people. We've had some professionals that were on the fence and weren't sure about it at first. And so I think a lot of people have come along now that they've seen how it's brought awareness to the issue.
I think that's a great point, Kay. And I would say, we're all a team here. We're all fighting for the same thing. So, Carrie and Kay and the rest of the Thumb group, we meet regularly and brainstorm, like, what are some other ways that are cost effective that we can get out there with this information? And also we bring up challenges. If someone, they're not able to promote it, or they can't get it to the right level, or it's just not resonating, or they have concerns, we'll talk it through. And so, we're happy to be a resource for for those of you on the call today that may be thinking about where do I get started? Who do I bring this to? We've got a 1-pager for the state project. The Thumb Group has lots of really good information that, that they can share as well. So you can really start anywhere, and we're here to support you because we're all in this together, and we're excited to be able to present this today. So thank you, Victoria, and everyone who invited us to do this talk. We hope that it will lead to more collaborations. So thank you, everybody.
Oh, thank you guys for presenting. It was a great, like I said before, it was a great presentation. I hope everybody learned a lot about this really great presentation. If you haven't checked out the Facebook Man Therapy website and the Facebook, I encourage you to go there. It's a great time to just even go there yourself and look at the resources provided. Thank you for joining us today, and we hope you have a great rest of your day.
Bye-bye.